Dr. Swaroopa from RITUS Advanced Skincare. So, how to get rid of hirsutism or unwanted hair? So, unwanted hair is nothing but a thick hair in females, which grows as like in male. So, there could be racial differences wherein the hair which is thick in case of South Asians which is considered as abnormal to a Caucasian. So hair growth usually it is dependent on the androgens which are secreted by the ovaries and the adrenals. So when the female reaches the puberty, it is the adrenal gland which secretes the androgen for the first time. So, and this is responsible for the growth of the axillary and the pubic hair. Whereas in the case of face or the chest and the upper pubic area as well on the ears, it is because of the androgens which are to be secreted in large amounts, and then only we can see this growth. Whereas the thick growth which is present in these areas is usually because of the excess androgens. Whereas in the case of axillary and the lower pubic hair, it is usually because of adrenal androgens, and even though they are present in very small amount, so the growth would be seen. And apart from this, we also have eyebrows, eyelashes and the lanigo hair, which is a thin hair present in the babies. It does not depend upon the hormone, that is the androgen. And the androgen, this is like whatever we call this unwanted hair, is not only because of the excess secretion of the hormone, it could be also because of the circulating androgens, because they usually bind to some proteins in the blood, and then they go to the target area and get attached to it, and they cause the action. Like it could be a growth of the hair, or it could be an acne eruption. So they get attached to the skin and then the action starts. So in this case, what happens is, like wherever there is a defect, like not a defect but altered metabolism, like ovaries, they secrete estrogen, and when the estrogen levels are high or they are normal, so the sex hormone binding globulins are also normal, and so we don't have any effects. Like the hirsutism is not seen in a female, whereas thyroid hormone also influences the sex hormone binding globulin. So when a hypothyroid patient, like a patient suffering from hypothyroidism, because these hormone levels are low, the sex hormone binding globulins are low because of decreased thyroid level. So the more amount of free testosterone is present in the blood to act upon the peripheral organs, wherever it might act, either it could be on the skin, on the hair, or anywhere the target organ will get stimulated. So those areas the hair growth increases. This is the reason where, so even though a patient is hypothyroid, he may also develop increased hair growth. And also we have seen certain conditions like in increased ACTH or increased prolactin levels also, they increase the adrenal androgen output, because androgens are produced both by the adrenal glands and also by the ovarian. So when this adrenal androgen output is increased because of ACTH increase, it's usually caused in some diseases like Cushing's, and also we have the luteinizing hormone which is secreted, when it increases, it causes the increased ovarian androgen output. So this is commonly seen in few conditions like PCODs, also in some adrenal tumors wherein the adrenal gland secretes more hormone, and then these side effects like increased facial growth or the virilization of, like what you call, if the mother gets pregnant, or the female will show the abnormal features of the genitalia also. We have a condition called PCOD, wherein the patient becomes obese, and because of that there is altered ratio of the estrogens and progesterone, thereby changing this hormone binding globulins or protein levels, and therefore the free testosterone is more available for it to act on the organs, thereby causing the hirsutism or the unwanted excess hair growth. So, or it could be because of intake of junk foods, which might increase again the insulin-like growth factor and thereby increasing the insulin resistance, and people are prone to develop PCOD. So it's not directly, sometimes it's not directly the testosterone or the androgens which are secreted in excess, but because of the influence of other hormones or because of their altered metabolism, the proteins which are binding them, their levels might be altered so that the excess of the free hormone is available to act on the peripheral organs. So, and we have a series of tests. So usually when a person comes with hirsutism, we usually do a series of tests, like it could be ACTH, the basic one is LH-FSH ratio, and the serum testosterone levels, adrenal androgen levels, and also we see the prolactin levels, and there are few tests to be done. So in this case, what we see is, like, once we take care of all these things, we understand where is the cause, we can easily treat the condition. In case like PCOD, because of obesity, so because of developing insulin resistance also, people, they develop hirsutism, and once the patient tries to reduce the weight and things like the diet and all are taken care, sometimes this problem also comes down. And so we need to investigate and treat the underlying cause. And apart from that, because we should take the food containing lot of fruits and vegetables and reduce the intake of junk food. So once we take care of the cause, take proper food, diet and exercise, so most of them it could be controlled. But even if we can't get the disease under control, then we need to go for some oral medications like spironolactone, cyproterone acetate, and also OC pills are also considered along with these medications. And once the things get settled, then the residual hair which is present, that is to be treated. And for this, laser hair removal is the best option. And up until now, like, the best hair removal laser is diode laser for fine hair, and we have also other lasers like Alexandrite lasers and all for very fine hair, but this is the best hair removal laser for unwanted hair, and it minimizes the hair growth to such an extent that the hair becomes thin like a lanivo hair and it would not be visible.